Lamar University Baccalaureate of Science in Nursing Capstone and 5-year plan. Leanne Cowles, that's me. I'm an RN. I graduated from nursing school in 2017 and started my third career as a cardiovascular nurse for Del Seton Medical Center at the University of Texas in Austin, Texas. There are moments in your life that change your existence. Becoming a nurse was one of those moments. I knew right away that nursing was what I was meant to do. I acclimated very quickly to my position and felt a duty to provide exceptional care. When I started this program, at first I felt resistant to study and learn new material, but that quickly changed to yearning and striving to be a better scholar. The 1.3 grade point average I started with when I returned to college is now 3.6 as I finish this baccalaureate. I originally began the Masters of Nursing program, but changed pathways to finish with a BSN. I plan on applying to the University of Texas Medical Branch in Galveston for the Adult Gerontology Acute Care for the Fall 2020 program. I aspire to become an advanced practitioner specializing in cardiovascular rehabilitation for rural counties. This presentation was designed to address several learning outcomes that were achieved during this program. I first off want to thank the faculty and professors for your patience and your support through the semesters. The next several slides will explain what outcomes the program's focused on and how I achieved those. How did I achieve patient-centered care from a global perspective? AIDS is a global epidemic that is prevalent in several countries around the world. This topic was written by a couple of classmates and myself for the Global Health Online assignment in our Care of Communities 4540 nursing class. We wrote facts about the virus and acknowledged international partnerships between governments that help target the battle against the spread of HIV/AIDS, such as the Global Fund. The Global Fund provides treatments to affected mothers to stop the virus from infecting their newborns. Hundreds of thousands of pregnant women received treatments in 2017. We also found research that had information about possibly developing a vaccination. However, this was proven difficult due to the difficulty of identifying T cells that attack HIV antigens because every person responds differently to the infection. I believe I met 100% of this goal. My knowledge of preventing disease and maintaining wellness, promoting and restoring health guided the activity number 2 assignment in the Holistic Health Assessment 4316 class. This assignment analyzed a case study involving an 8-year-old boy with symptoms of an upper respiratory infection. The paper started with a problem statement that reported an acute productive cough and thin clear sputum and a sore throat. My assessment associated the Newman system model theory, introducing the concept that variables of an individual are in constant connection with their environment. The assessment also evaluated subjective and objective data, short-term and long-term goals, a nursing diagnosis, and treatment interventions. I believe I met 100% of this goal. Promoting health is an important aspect of nursing. Displaying competency of patient-centered care for compromised health states and complex health needs was demonstrated in Dr. Douglas's Compromised Health States 4620 class. Several practicum reflections were assigned in relation to a memoir that I chose to read for this class. The memoir was about a lady who suffered from stroke-like symptoms but had difficulty being diagnosed with her neurological condition. I interviewed patients that had undergone cerebral vascular accidents. I explained the pathophysiology, associated symptoms such as urinary incontinence, researched community resources, and incorporated communication techniques in accordance to several interviews, and then related this condition to the memoir I read. I believe I met 100% of this goal. How did I demonstrate clinical judgment utilizing nursing process and research during this program? Several classes assigned papers that involved critical thinking regarding nursing processes. One in particular was the prospect paper, Maintaining Skin Integrity for Urinary Incontinence, written for Dr. Curls, Nursing Research Master's 5311 class. This paper was the product of a 16-week-long course dissecting and analyzing research, one of the hardest classes I have ever taken. The study focused on the effectiveness of wicking away urine by an external non-invasive catheter device, providing integrity for urine-exposed skin. I explained variables, research design, data collection, limitations to the study, statistical analysis, literature reviews, intervention and product comparisons, and their results. I also constructed a PowerPoint presentation for this study, which was downloaded to Kaltura with a voice recorded narration. This was 100% met. Patient-centered care using theories. According to RN BSN Student Handbook, when coming to the end of this program, I should be competent enough to employ safe and effective patient-centered care, have adopted theories and evidence-based findings in collaboration to the entire healthcare team, including the patient. Prior to starting this program, I knew nothing about nursing theories until Dr. Green Morris's Master's 5310 Theoretical Foundations class. This class introduced several theories and nursing predecessors that I continued to incorporate throughout this program. The final assignment for this class was the Theories in Clinical Solving paper, which I chose the theory of goal attainment by Imogene King and Betty Newman's system model. I applied these two theories with clinical problems that I had encountered at the time in a hospital setting. I can honestly say that I continued to collaborate theories in my nursing routine among the entire healthcare team. This goal was 100% met. Did I provide multiple role dimensions within ethical, legal, and regulatory parameters as a member of the healthcare team? This goal was 100% achieved when I self-analyzed my personal strengths and weaknesses and recognized what leadership qualities are effective as a member of an intraprofessional healthcare team. This was written in the Effective Leadership and Qualities paper for Dr. Stacy Knight's Leadership Management Health System 4550 class. The paper gave examples of short summaries of daily encounters that helped shape my skills of effective leadership. I also put a quote in, "Nurses demonstrate leadership when they adjust their leadership styles." I demonstrated professional integrity, effective communication, active inquiry, and service to the community. In the Care of Communities 4540 class, I conducted a windshield survey and reported findings in the practicum assignment number 1 regarding the increasing population of the homeless in Austin, Texas. I provide nursing care to a great number of the homeless population by working for a nonprofit organization that is located downtown Austin. This survey reported U.S. Census Quick Facts, analyzed surrounding neighborhoods, subsystems, and collected observational data. I also developed a teaching plan for the homeless population if a flash flood disaster occurred. I developed a PowerPoint for that teaching plan, and it is in Kaltura. I also presented another PowerPoint presentation about a community organization that I chose to volunteer for called Foundation Communities. I believe I met this goal 100%. Professional Development Plan. As my excitement increases with the notion that this baccalaureate program is coming to an end, I realize that a goal will be completed. Over the last 3 years of providing nursing care, developing my skills, and fine-tuning my knowledge through this program, I am confident that my practice will be competent and safe. I expect my skills as a professional nurse to be above the standards the state of Texas requires. I promise to provide professional nursing care that involves monitoring, evaluating, educating, and intervening in accordance to my patient's health state. I will forever uphold respect to the nursing processes, practices, policies, and procedures. I plan on working for Ascension Seton Healthcare for many years to come. I appreciate the mission and values this organization has for their patients as well as their employees. I will be applying to a higher level educational program where I expect to graduate from in 3 years. I will continue my excitement as I start this next chapter of my healthcare profession. Thank you.